Today, some House Republicans on the GOP study committee actually going to get a chance to sit down with Health Secretary Kathleen Sebelius. That'll be this afternoon. The chairman of that committee is Georgia Republican and physician Tom Price. Dr. Price, Representative Price, joins us now. Congressman Price has his own plan for health reform, most notably a bill called Empowering Patients First is the name of the act. Also with us, the Washington Post's Ezra Klein, who blogs about domestic issues for the Washington Post and has been doing an exceptional job of staying abreast of all the various minutia, if you will, and the critical minutia that is this legislation. Representative Price, a pleasure to have you here. I want to highlight some of the aspects of your bill, Empowering Patients First Act. H.R. 3400 has a tax deduction for non-group insurance, which again benefits those, the uninsured and the portability sense, tax credits for people up to 300% of poverty level, auto enrollment and employer-sponsored insurance, and then this is key, can opt out, which again the president's line, you can keep it if you want it. What he didn't tell anybody was if you don't want it, you're not allowed to leave. You're saying you can. Thank you. Right. Shop across state lines, etc. So walk us through the core principles for reform that you're going to discuss this afternoon with Secretary Sebelius.
Thanks, Dylan. Great to be with you. I think the take-home message is that the status quo is unacceptable and Republicans have positive solutions to meet the challenges in health care. They would get folks insured, make certain that everybody has the financial wherewithal to get insured, but it's to pick their coverage, their health coverage, not the one that the government picks for them. That we make certain that we solve the insurance challenges of portability or pre-existing conditions or injuries or illnesses. You ought not lose your insurance if you change your job or you lose your job, and you ought not be priced out of the market if you happen to have an awful diagnosis. We need to make certain that decisions are made between patients and families and doctors, not bureaucrats here in Washington. And one of the most important things that's not addressed in the Democrat plans is lawsuit abuse reform. There's no doubt that the practice of defensive medicine is driving up the cost of health care for every single American. We need to make certain that we solve that challenge. We can do all of those things without raising taxes one penny. So you don't need to increase taxes or slash Medicare. You can solve these challenges.
Ezra Klein, we talked a lot about the Wyden choice amendment that never even made it to a vote with Baucus. What's your sense of the compare and contrast Representative Price's bill and what we saw from Senator Wyden last week?
You know, I've thought Representative Price's bill is one of the better alternative bills out there. There are a couple things I'd like to see people take a closer look at, including particularly auto enrollment, which I think is a very good idea, and Representative Price, I think, does a service by taking more direct aim at the employer tax deduction. Conversely, and this is important for the Wyden plan, but it's important for everything, Representative Price's bill does not go far enough, I think, on universality, on extending coverage to all people. Part of what Wyden is saying, part of what Senate Finance Committee is saying, and part of what, for that matter, insurers are saying, is you really can't do this if everybody isn't in the pool. The biggest problem here is adverse selection. Happens on both sides. Insurers try to get the healthy try to not get insured. And unless you put down some regulations, some government, in fact, it is very, very hard to get a good competitive market. There's a great op-ed in the New York Times yesterday from a guy who ran the Texas State Exchange when they did one, which is very much like what Representative Price has in his bill. And he said it failed, and it failed because we couldn't handle adverse selection because not everybody was in the pool, and insurers didn't have to insure everybody.
Representative Price, how do you deal with that factor? It's like only people who have car accidents buying car insurance. It gets expensive.
Now, the challenge that Ezra doesn't point out is that if you have an individual mandate, that what Congress does is define what it's mandating. And in this instance, it would define what qualifies as health coverage or health insurance. And what the House would do, which they've done in 3200, is to say that all of those wonderful things out there like health savings accounts and high-deductible catastrophic plans would not only be unavailable, they would be illegal. And that's why a mandate's a bad idea. The way that we solve the challenge is to make certain that folks can pool together robustly with millions of other Americans so you don't get the adverse selection. The reason that we get the adverse selection now is because we are confined by the small pools that we have.
Representative, I take issue with that in that if the healthiest among us, quite honestly, knock on wood, somebody like myself, looks at the high cost of health insurance, assuming I wasn't on an employer-based plan, the bias for somebody in my situation is, well, why am I going to pay all that money for that health insurance when I don't really need it? And then on the flip side, the employers say, hang on a second, you want to let everybody opt into other plans, and then I'm going to get stuck as the employer with only the sickest and the weakest, and that screws the employer. So without mandating everybody in the pool as a law, as we do with car insurance, how do you, I don't see how you reconcile adverse selection.
You do so by making it so that it's financially attractive and foolish for anybody not to be insured. And you do that through the tax code, and it's a relatively simple thing to do. The solution that we want is one where each and every American says, look, it makes more sense for me to be insured financially than it does not. But it's the insurance that they select for themselves and their families, not that the government selects for them. There's a wonderful way to do this that makes it so that the government isn't in charge of all this, that people are in charge.
No,
and that's, in fact, the way to get the system moving in the right direction.
Just jump in here for a second, I think it's important to say this has been tried and it hasn't worked. I think there's a logic to the congressman's proposal, but we have tried this. A number of states, California, where I come from, was one of them. Texas was another. A number of states in the middle of the country, some in the South. We have tried to create these voluntary purchasing pools, put them up with tax credits, bring people together, bring the cost of insurance down. Sometimes it's worked a bit, sometimes it's failed, and always in the long run it has failed because it couldn't get over this problem. Other countries that have a private system, the Dutch have one, Sweden have one, they all use something like an individual mandate and regulations. I understand that the congressman has a philosophical objection to government defining what is a minimum level of insurance, but it does not appear we can make this work without it, and that's why we haven't been able to make it work. It's not like Texas haven't thought of it.
Let me suggest, if I may,
please.
Let me suggest, if I may, Dylan, is that the incentives from the state level are pale in comparison to the incentives that we can provide at the federal level. And so I would suggest that what we want to do is move patients in the direction of having that control and not the government. And it's so terribly important because, again, in 3200, the bill that will be before the House and has been in committees, it outlaws many things that millions of Americans currently use for their health coverage.
Understood. I guess I come back to car insurance. We have it is illegal for me to register my vehicle in New York State without purchasing insurance for that car, and the government decides what the minimum threshold for what having insurance is. I don't have to get collision. I do have to have liability. You know what that is. Why can we not simply mandate some other minimum? I understand it's a political debate as to what that minimum is, and I understand your objections to 3,200. For all I know, I would object to them, and lots of other people would. But why can't we at least indulge ourselves that debate with the knowledge that the government's responsibility when it comes to something like insurance, whether it's car insurance or health insurance, because of adverse selection, because it hurts employers and it hurts the system if the government doesn't set those rules, that we have no choice but to create a legal structure that enforces car insurance, health insurance, etc.
Sure. It may be appropriate to do that if, in fact, that coverage were to be a high-deductible catastrophic plan. But the problem with the current leadership is that they have refused to do that. In fact, they want a soup-to-nuts health coverage. In fact, the Federal Employee Health Benefits Plan would not be eligible to be sold under the Democrats' plan in the House of Representatives. That's how lavish the plan is.
Understood.
And that's the kind of thing that will result in the $800 billion tax increase and the slashing of Medicare. So what we need to do is to step back, work together in this process, and come up with the positive solution that puts patients in charge.
Understood. And I think, just to reiterate Ezra's point, one thing is a fundamental debate on getting insurance to work and protecting all of us, employers and individuals, from adverse selection, and the other is a debate on what is health care. And I would hate to see the debate on what health care is get in the way of a mathematical problem we have, which is adverse selection.
The mathematical problem, though, is actually the financial incentive to get individuals to make the decision that they will purchase the insurance coverage that they want for themselves and their family.
Let me put it this way. If your incentive plan didn't work a year, would you be willing to do a one-year version of your incentive plan, and if it didn't work, then have a mandate?
Look, I think that if you put patients in charge and give them the opportunity, they'll do the right thing. I'd love to see that experiment because I think it'll work.
Okay. Listen, Representative, thank you so much for spending some time talking to us about your ideas.